Okay, today we're going to finish talking about cannabis or marijuana. In particular, we're going to talk about tolerance and dependence associated with marijuana use, talk about medical marijuana and marijuana legalization. Tolerance is one thing that does develop readily in animals within days to both the physiological and behavioral effects. It does require relatively high doses. Tolerance in humans requires high doses in chronic use. In one study, high doses of THC every 4 hours for 12 days showed tolerance to the high, heart rate increase, cognitive and motor impairment, etc. This lasted for 1 week off the drug, but tolerance did not occur to 1 cigarette a day for 28 days. So moderate to light use tolerance is less likely to develop. We certainly know that tolerance is not due to changes in pharmacokinetics. The body does not get better at metabolizing THC. What we do know is that THC produces downregulation and desensitization of cannabis receptors. Now, there's a question about dependence. More frequently described are mild to moderate withdrawal symptoms in about 50 to 60% of regular users who cease use. It's characterized by affective and behavioral symptoms, including anxiety, irritability, stomach pain, reduced appetite, and reduced food consumption. These mild withdrawal symptoms may contribute to continued use. We do know that there is no physical addiction potential with marijuana. Any attachment to cannabis is not a function of any inherent psychopharmacological property, but as an emotional driven by the underlying psychopathology. That is, this is a psychological dependence. There's no physical dependence associated with marijuana use, so people can become psychologically dependent on it. It just becomes a crutch. Now I want to turn to talk a little bit about the pharmacodynamics of marijuana, in particular the brain areas and receptors involved. Primary brain areas involved, that respond to tetrahydrocannabinol, are the basal ganglia. Cerebellum, which certainly has both of these two in combination, has significant effects on motor performance. The hippocampus, of course, which has effects on memory, and the prefrontal cortex effects here include effects on attention, memory, and concentration. There's very little bit binding in brainside areas that control breathing. You would expect this for a drug that does not produce a lethal respiratory depression, so not at all surprising there. To give you an overview of these brain areas, we of course have the frontal cortex, our decision making, social skills, basal ganglia, movements, cerebellum, also movements, and then the hippocampus, which is of course information storage and retrieval. As I said, there is no evidence that cannabis has addiction potential. There's very little evidence for it being involved in this reward pathway. The receptors are cannabinoid receptors. These are usually presynaptic. They inhibit calcium ion flux and facilitate potassium channels, which results in the inhibition of release of other neurotransmitters. To give you an idea about this complicated pathway, there are all sorts of binding effects, channel effects, etc. I'm not going to ask you about these in an exam. If you want to know more about that, you can study this in more detail. Suffice to say, it's an inhibitory drug that inhibits release of neurotransmitters. There are also what are called endocannabinoids, which are natural substances that bind to this receptor. These produce analgesia, decreased activity, and also decreased temperature. One of these substances is known as anandamide, which produces the same effects as cannabis on brain neurons and on behavior. So there are natural cannabis-like substances in the body known as endocannabinoids. Now, there are some possible therapeutic uses for marijuana, and of course this is not without its controversy. It's difficult to do this research because of the legal aspects and the ethical aspects, but there is evidence for possible therapeutic uses for marijuana. In particular, to treat nausea and vomiting, this is clearly an antiemetic drug and has been shown to be useful for treating nausea associated with chemotherapy. It is certainly an appetite stimulant, so it's good for use in patients with wasting diseases like AIDS wasting. Certainly there is potential for it to protect injury, to protect the brain following head injury through downregulation. Possibly good for treating as a muscle relaxer, so it may treat spasticity secondary to other neurological diseases. And certainly there's evidence for chronic pain syndromes such as multiple sclerosis, interstitial cystitis, and other types of peripheral pain syndrome. To give you an idea about how extensive medical marijuana is, currently in the United States there are 2 states that allow for any use of marijuana by those over the age of 21, and these are Washington State and my home state of Colorado. In medical use and some decriminalization, there are a few states allowed solely for the use of marijuana as a medicine. In some states, it's a civil infraction, not a criminal infraction, and then, of course, in a wide variety of states, including South Carolina, it is still a criminal act. The controversy here, certainly for me, is most of the laws enacted allowing marijuana to be used as a medicine were citizen initiatives, and there has been little in the way of peer-reviewed scientific evidence to evaluate the claims of whether or not this is truly a medicinal drug. Instead, we've left it up to the voters to decide, who probably aren't as well informed as you all are about how drugs work. Again, there are potential therapeutic effects. Spend some time looking at this if you'd like. We've already talked about some of these. Potentially treatment for asthma, potentially treatment for nausea caused by anti-cancer drugs, possibly palliative care for anorexia caused by opioids and antiviral drugs, AIDS-related terminal illnesses or cancer. Certainly possibly as an analgesic in postoperative pain, cancer pain, decreased spasticity and ataxia and muscle weakness for people who have multiple sclerosis and other injuries, and it certainly has the potential to be a treatment for glaucoma. There is on the horizon a Canadian approved, that has been approved in Canada, called Sativex, is the world's first natural whole plant marijuana extract to relieve pain from multiple sclerosis. It's also an effective analgesic for neuropathic pain. Manufacturer is seeking FDA approval in the United States. For the FDA to consider it, would have to concede that the entire cannabis plant has medicinal value, which obviously has a political problem. So, it is of course a question about what's going to happen there. So, final thing I want to talk about is controversy over whether or not to legalize marijuana. And I have an opinion. I'm not going to tell you what it is. But there are a wide variety of places you can look to evaluate the evidence for yourself. In terms of the pros of legalizing marijuana, we certainly know that the cost of prevention is high. We spend a lot of money tracking down and incarcerating individuals for smoking marijuana, money that could be spent more usefully elsewhere. Most of the problems associated with marijuana use are because it's criminal. Violent crimes, corruption, and huge profits of organized crimes would be reduced. We face the same problem with alcohol. When Prohibition was passed, we gave birth to the criminal enterprises that now sell marijuana, cocaine, and heroin on our streets. And all of the violence associated with the alcohol trade went away as soon as alcohol was legalized. That same thing could happen if marijuana were legalized. Certainly, take tax revenue. We have what we call sin taxes on other things like cigarettes and alcohol. We could take and apply a fairly hefty tax that would limit its use and also generate some money for other useful purposes. There are people who make an individual freedom argument. I think that's certainly valid. I don't think legalization would lead to an explosion of drug use. It's not that it's that hard to find marijuana now, and it certainly is not limiting its use at the moment, so I can't say that making something illegal is having any effect on reducing its use. Its purity and safety can be guaranteed. You could buy organic marijuana if you wanted to. And would probably reinstate some respect for the law, because this is a law that so many people violate. It sort of leads to this general idea that why bother with a whole bunch of other laws. So there is some question about its use. Now, there are some against arguments, of course. Most citizens do not want laws reduced, although it's very close right now. It's about 50-50. And obviously, in a lot of states that have passed marijuana legalization, that has been otherwise. There is certainly greater availability might lead to increased use and more problems, such as with alcohol and nicotine. Possible that legalization would increase health costs and use up all the tax benefits we might have. I would argue that we have the health costs anyway, so might as well get the taxes. These people on this side of the argument say that the right to privacy is not relevant, that drug taking is not purely private, that there is a danger to non-users, of people intoxicated at work, that drug-related crime would not go away, the market would move to another substance, and underage kids would be targeted. Argue that there's not enough food in the world, why would we waste more land on growing cannabis? Well, and then getting money from confiscated resources of drug sellers, people who sell drugs or caught selling drugs, their money and equipment can be confiscated and sold. That could obviously be offset from increased taxes. I urge you to read a variety of places online. I posted several articles to Blackboard about this issue. Certainly it's going to continue to gain momentum in the public consciousness, and something with which you might want to be aware. Alright, next we're going to talk about other psychedelic drugs and their use.